Over the last 24 years, the Christian Health Association of Kenya has undergone tremendous all-round growth in infrastructure, net worth, programs and projects, partnerships, human resources, advocacy, and recognition as a key player in the health sector. Dr Samuel Mwenda has been the man at the helm of the organisation during these years of unprecedented growth as the Secretary General of the Christian Health Association of Kenya.
I've been serving in the faith-based health sector since I started my medical career. It became a calling for me from the time I chose to train in the medical field. And I consider myself to be a servant in the vineyard. I've been serving within the faith-based, the church health institutions. It's been a pleasure for me to serve within CHAK. I've had the privilege to serve with a great team in CHAK through its ministry of health and healing for the last 24 years. I arrived at CHAK on 1st of April 2001. The Christian Health Association of Kenya then, which I had known from out there serving in a member hospital, was really a small institution. It had gone through very major restructuring, having lost a huge project that was running around the country, and had reached a point where it had to kind of restart afresh. So I came in as the Second General Secretary after that major restructuring, where CHAK decided to shift from being an implementer, direct implementer of projects, to a facilitator, more of providing technical assistance and supporting its members to do actual delivery. It had a small staff establishment of only 16 members of staff, everybody, including the security guard, the cleaner, messenger, and to the managers and myself as the General Secretary. But it was a committed team. We also had a very small office building. Thankfully, the trustees and the founders of CHAK had worked hard and have been able to buy an office building, which was basically a residential house. So we were staying in a residential house, and it was able to accommodate that team. We also had a very limited IT infrastructure. We had a few desktops. I think the only laptop that was in the whole organization was the one the General Secretary had. And there wasn't any internet. We had to do dial-up to send messages from only one desktop computer, which was with the secretary in the General Secretary's office. So if you had a message to send, you had to come to her to type it for you and to mail it out. So it was very modest, very humble beginnings, but we believed in the potential and the mission of CHAK. When we looked at the foundation of us, Revelation chapter 22 verse 2, which paints the picture of a river flowing down the middle of the city, coming from the throne of God, and on either side you have trees which are very productive. They produce 12 crops of fruit each year, meaning every month they are producing fruits, and the leaves are for the healing of the nation. So we felt called upon, challenged to be part of this ministry, to work with our members to accomplish the desired impact of enabling them to provide the services that deliver healing. And since we are people of faith connected to God and to Christ, because we are called this ministry, we were confident that we will be able to keep growing as we build friends and partners, as we kept committed. And we had a very supportive board, I must acknowledge, the executive committee. And members, although did not have that great interest in the organization, I think they were still connected with CHAK, and they had interest in seeing CHAK turn around and continue being an effective instrument for them.
During the last 24 years, the staff complement grew from 16 to the current total of 135, with diverse talents and qualifications to implement the organisation's growth agenda.
We have worked together, all the staff, from management to all the technical staff and everyone in the organization, to pray for the organization, to pray for the work, to work together as a team, to do planning. Every 6 years we do strategic planning. And in every new plan, we set higher targets. And God has been gracious. So CHAK has grown in terms of capacity. We have been blessed with a lot of staff who have joined, bringing very rich experiences, people who are very talented, people who are very committed, with diverse skills. We have expanded our work in terms of programs that we run. We have maintained our connection, our engagement with membership, and our members have also been growing, which has contributed to our strength. When we see the growth in some of the hospitals, we have been able to attract donor funding over and above the faith-based or ecumenical partners that we had from our churches.
In 2006, construction of the CHAK Secretariat offices and CHAK Guest House and Conference Centre began, marking a key accomplishment in the growth of the organisation. When it was all done, CHAK now had a home, a modern office complex and training centre. From a once humble office premises, CHAK now stands magnificent in Nairobi's Lavington area, with the conference centre and guest house having hosted countless high-profile guests from around the world.
In 2005, we did a proposal that was accepted, and in January 2006, we started the actual construction. This has been one of the greatest moments for us, and we were able to get that accomplished. We did it in 3 phases, and phase 1 to 2007. By 2009, we had finished all the phases. So we got a beautiful new home, both for both the offices, secretariat, and we got a guest house, which offers training facilities and other meeting facilities.
When he came in, Dr Mwenda found a fairly modest institution with a net worth of about 21 million Kenyan shillings in terms of assets and a sizable figure in regard to membership. In 24 years, there has been remarkable progress. Financially, CHAK has continued to thrive. From net assets totalling 22 million Kenyan shillings in 2001 compared to over 540 million Kenyan shillings currently, and revenues of over 1.6 billion Kenyan shillings as at the end of 2024. This growth has been spurred by a robust governance system encompassing the entire CHAK membership through the AGM and CHAK regions, through regional coordinating committees, the board, management and secretariat staff, whose operations and activities are supported by bold and visionary strategic plans updated every 6 years. CHAK's membership has grown rapidly and currently stands at over 600. In its membership ranks, CHAK has a wide array of health facilities, including higher-level hospitals that provide specialised services such as cardiothoracic surgery, orthopaedic surgery, oncology, specialised eye care services, paediatrics, among other disciplines, as well as lower-level health facilities, including dispensaries. CHAK strives to reach as many as possible in this wide array of member health facilities with services and products. There are several factors that have contributed to this tremendous growth in CHAK. Dr Mwenda delves into them to point out the reasons why CHAK has made it this far as an organisation.
Well, I think having a vision, and being focused on where we are going, having good leadership, good stewardship, having a very committed, talented, dedicated team of staff at all levels, having a governance that is supportive and that is aligned to the vision of the organization, aligning our work to the priorities in the country, and also being very cognizant of the need to keep being relevant to our membership, and then being open to partnerships.
In his parting shot, Dr. Mwenda is convinced that CHAK will continue to offer crucial health services in the country for many years to come. He is grateful for his personal journey throughout this incredible journey of the organization and offers gratitude to God for the far he has come.
I'm proud of where CHAK has reached. A tremendous growth. The institution is very solid. It has very well-established structures. It has expertise in all areas. We have a robust ERP, an enterprise resource planning system that is managing all aspects of our operations. We have built a lot of reputation and confidence with partners in terms of managing resources. We have a good place in the health sector in terms of appreciation, recognition, and inclusion. But above all, we remain firmly committed to why we are set up, to lead the support for the faith-based or the church health facilities in building their capacity and facilitating their provision of quality health service. Our focus remains promoting access to quality services. So the other one is to say thank you to all the partners who have the confidence to work with me as a leader. You know, many times you develop a relationship with a leader. If they don't have confidence in the leader, you very rarely get partners wanting to stay on. There are those we started with right from the beginning, like Bread for the World. We are working together and we've done so much. I really appreciate them so much. Not so much because of money, but because of the friendship, the confidence, and the partnership that we have. And of course, many others who have come from in their diversity. And I want to tell my colleagues who have been my great family members, we remain family, we remain connected. You are CHAK, whether you work in CHAK or you're out. And I know I come from a church, I found a church of CHAK, so I wouldn't be surprised if I continue still getting engaged. But I'll remain within the sector, and I'll be an advocate for the good work and the potential of the faith-based. There's a lot of work to be done, the sky is the limit. I want to tell my colleagues, thank you. You've been such a great support for me, and you are a great team, and there's so much more that you can actually accomplish. Keep working together as a team.